Hello, I'm Dr. Emily Carter, a urology specialist from the United States. This year, I am 45 years old, and I have spent more than 2 decades conducting in-depth research on the complex intersection between the urinary system, the nervous system, and sexology. Throughout my career, I have witnessed thousands of men walk into the clinic with the same heavy burden, a quiet insecurity that sometimes they don't even have the courage to share with their own partner. Today, I'm standing here, not only as an expert, but also as someone who understands, to help you unpack a reality that is silently gnawing away at the happiness of millions of men worldwide, losing an erection right in the middle of making love. That means for every 2 to 5 men you meet, at least one is dealing with difficulties in sexual performance. However, there is one extremely important detail that medical sources and real-world treatment experience have confirmed. For many men, the first symptom of erectile dysfunction is not being completely unable to get an erection, end quote, but rather losing firmness while sex is already happening. This is a shocking truth, but it is also full of hope, because it shows your system is still working, but it is running into obstacles that disrupt the flow and prevent it from being continuous. In medicine, we do not see this as a life sentence for your sex life. On the contrary, I believe this is an early warning bell, a signal for you to start paying proper attention to your male health. And the biggest good news I want to give you right here in the first part of this story is this. In most cases, this problem can be completely improved without surgery and without expensive support drugs with heavy side effects. The methods I'm about to share with you, the keys that help you stay strong all the way to the end, will focus directly on the deepest root causes. You can start applying them as soon as tonight, right in your own private space, and feel a clear change. We will not only talk about dry theory. Get ready, because your journey to regain confidence begins right now with the most accurate understanding of your own body. To understand why your strength suddenly drops right in the middle of the moment, we need to look deeper inside to where a sophisticated biological mechanism is at work. Imagine the erection process, like trying to pump up a tire. For that tire to become firm and hold pressure throughout, 3 factors must coordinate perfectly. First, blood must be pumped into the penis, very quickly through the arteries. Next, that blood fills the spongy chambers, known as the corpora cavernosa. And the final step, the most important step for maintaining endurance, is that the veins, which are the exit route for blood, must be compressed tightly to keep all that blood inside. When you lose your erection in the middle of sex, it isn't random. In medicine, we call this phenomenon venous leakage. Put simply, blood is escaping faster than it is being pumped in. To help my patients visualize it, I often use the image of a leaky bucket. Imagine you are trying to pour water into a bucket that has a hole at the bottom. If you pour water in faster than it leaks out, the bucket will fill. But if the flow slows down even a little, or the hole at the bottom gets larger, the bucket will empty. almost immediately. Your penis works in the exact same way. One medical study pointed to a truly surprising number. You only need to lose about 15% of the smooth muscle function in the corpora cavernosa, and the symptoms of venous leakage will begin to appear clearly. That means you don't need a total breakdown to have a problem. Just a small decline in the system's ability to contract and trap blood, especially on the venous side, is enough to make strong performance suddenly fade away. And this is the key to decoding the obsession that haunts so many men. Why do I feel powerful at first, but only a few minutes later everything disappears? It's because your venous locking mechanism is out of sync. When incoming blood flow is no longer strong enough to maintain pressure and overcome the leak, the erection collapses like a balloon pierced by a needle. Understanding this is a major turning point, because instead of worrying in the dark, now we know exactly what the target is, how to regain control of the flow, and seal the leak at its source. After we have understood the biological mechanism behind venous leakage, the next big question is, what is actually causing that leakage? In more than 2 decades of practice, I have found that losing an erection never comes from a single cause. It is usually the combined effect of multiple factors. To make it easier for you to recognize your own situation, I classify them into 3 main groups of causes: physical, psychological, and lifestyle. First is the physical group. These are the mechanical faults in your operating system. It can be poor blood circulation, meaning the blood flowing in doesn't create enough pressure to fully close the veins. Or, more commonly, it is weakness in the pelvic floor muscles, the guards, whose job is to squeeze the veins tightly to keep blood trapped inside. In addition, side effects of medications also play a significant role that many people overlook. The second group, and the one that surprises many of my patients the most, is psychological causes. Did you know that performance anxiety is the leading cause of losing an erection during sex, especially in men over 50? When you start worrying about whether you can maintain firmness, your brain sends out an alarm signal. At that moment, the sympathetic nervous system, also known as the fight or flight mechanism, is activated. This response causes blood vessels to constrict, reducing blood flow to the penis and making it soften quickly. This becomes a brutal spiral. One failure leads to anxiety, and that anxiety causes the next failures. Beyond that, issues like depression, work stress, or cracks in the relationship are also silent killers that choke off your arousal. Finally, the third group comes from lifestyle, daily habits, like smoking, drinking too much alcohol, or having poor physical fitness. From a lack of movement, all directly damage erectile function. Nicotine in cigarettes constricts blood vessels, while alcohol weakens the nerve signals between the brain and the sexual organs. I once treated a 59-year-old patient who was devastated when he told me he could achieve an initial erection but always lost it after only a few minutes. After a thorough review, we identified 5 specific issues across all 3 groups of causes. After just 3 weeks of making structured adjustments, he regained his confidence and was able to maintain stable firmness throughout sex. The key here is that you must identify precisely which group of causes is affecting your case so you can fix it scientifically. Don't rush to blame age, because as I said, most of these causes can be corrected if we go in the right direction. In the previous chapter, I mentioned psychology as one of the 3 main groups of causes that create trouble for men. Now, I want to emphasize this. Performance anxiety is the biggest killer of erections, especially for men in middle age. It usually starts with a random glitch one time. The embarrassment of that first moment gets recorded very clearly by the brain. And the next time you have sex, instead of enjoying it, you begin to fear that it will happen again. This anxiety activates your sympathetic nervous system, also known as the fight or flight response. When this system turns on, blood vessels constrict. Blood flow to the penis drops significantly, and naturally, the erection becomes weaker. This is a brutal spiral. The more you worry, the easier it is to lose your erection. And the more you lose your erection, the more you worry. Research has confirmed that factors such as depression, anxiety, low self-esteem, and relationship stress can directly cause or worsen symptoms of erectile dysfunction. To break this cycle, the first key is cognitive reframing. You need to understand that occasionally losing an erection is completely normal and happens to every man. At some point, it does not mean you are broken or that something is seriously wrong. Second, communicate openly with your partner. Don't stay silent in the dark. Try saying, "If I lose my erection tonight, it's not because of you. I'm just having a small circulation issue. Let's still enjoy this closeness." This can relieve psychological pressure extremely effectively for both of you. Besides psychology, another common mistake is that many men stop stimulation as soon as penetration begins. You need to remember, an erection requires continuous arousal signals from the brain to the penis. When stimulation stops, those signals weaken, blood begins to escape, and the penis softens. So, maintain continuous connection, both mentally and physically, throughout sex. Don't let your mind drift to work or life pressures. Look into your partner's eyes, talk, and touch their body to keep arousal signals strong and steady. And if you feel your erection starting to decrease, don't panic. Pause penetration and return to manual or oral stimulation until firmness comes back, then continue. Focusing on pleasure instead of obsessing over performance is the most effective way to keep your strength steady and strong. Next, I want to take you deeper into an aspect that I truly believe is the sustainable foundation of male strength, power from within. In medicine, we don't only look at what happens on the surface. We focus on the core muscular system, quietly coordinating the flow of life. The biggest mistake many men make is neglecting the pelvic floor muscles. Studies have shown that weakness in specific muscle groups, including the bulbospongiosus muscle and the ischiocavernosus muscle, is a leading cause of venous leakage and loss of erection. These muscles function like a locking valve. Their job is to compress the veins, which normally carry blood out of the penis, so blood stays trapped inside. When these muscles are weak, they cannot maintain enough pressure to fully close the veins. Blood escapes, and your erection disappears. The solution I give my patients is extremely simple, yet can feel almost miraculous. Daily Kegel exercises. To do it, identify the correct muscle group by imagining you are trying to stop your urine stream mid-flow. The exact protocol I recommend is this: contract those muscles and hold for 5 seconds, then relax completely for 5 seconds. Repeat this cycle 10 to 15 times per set and do 3 sets per day, in the morning, in the afternoon, and in the evening. The wonderful part is, you can do this anywhere, sitting at your desk or driving a car without anyone noticing. According to scientific evidence, after only 2 to 4 weeks of consistent practice, pelvic floor strength can improve significantly, helping you trap blood better and maintain firmness longer. Alongside training your internal power, choosing the right strategy during sex is just as important. One reality many men don't notice is that positions requiring excessive effort can weaken performance. When you do positions like the traditional one while using your arms to support your full body weight, your heart must redirect blood and energy away from the penis to supply your arms, chest, and core muscles. My advice is this: switch to strategic positions where you can relax as much as possible. The woman on top position is an excellent choice because it allows you to lie back comfortably and fully relax. Side-lying positions, or a modified traditional position, where you rest on your knees instead of supporting yourself with your hands, also reduce the burden on your circulation. Remember, choosing positions intelligently means you don't have to fight gravity or exhaustion, so you preserve blood flow for where it matters most. Combining pelvic floor training with smarter positions is the physical key to taking control of the game. Continuing from the immediate solutions, in mindset and technique, I want to discuss an area that is more foundational and long-term: medical control and lifestyle. Over many years of treatment, I have found that there are invisible barriers sitting right inside your medicine cabinet or hidden inside daily habits without you even realizing it. First, do a serious medication review. There is a truth that many doctors sometimes forget to warn about. Many common medications have side effects that can cause erectile dysfunction. Antidepressants, especially SSRIs, such as fluoxetine and sertraline, as well as blood pressure medications, like beta blockers and thiazide diuretics, are among the top culprits. Even allergy medications, antihistamines, or medications for the prostate can reduce the ability to maintain an erection. I once had a patient who was taking a beta blocker for blood pressure, and it completely wiped out his sexual performance. After we discussed it with his cardiologist and switched him to an ACE inhibitor, his sexual function fully recovered in just 3 weeks. My advice is this: never stop your medication on your own, but do schedule an appointment with your doctor to discuss alternatives that have less impact on sexual function. Next, we have to talk about alcohol. Many men assume a few drinks will make them more confident, but in reality, alcohol is a central nervous system depressant. It weakens the nerve signals between the brain and the penis. It also causes whole body vasodilation, which lowers blood pressure, making it harder to maintain the high pressure needed inside the penis. Limit it as much as possible. At most, have no more than 1 drink at least 2 hours before sex, or ideally, remove alcohol completely on nights you plan to be intimate. Alongside that, managing chronic disease is non-negotiable. Diabetes, high blood pressure, and high cholesterol directly damage your blood vessels and nerves. If you have diabetes, work to bring your A1C below 7%. If you are overweight, even losing just 10% of your body weight can significantly improve erectile function by reducing inflammation and increasing testosterone. Finally, the foundation of everything is quitting smoking and starting to move. Nicotine is the enemy of blood vessels because it causes immediate constriction and reduces blood flow. Instead, commit to at least 30 minutes a day of aerobic activity like brisk walking or jogging. This habit increases nitric oxide production, helps blood vessels dilate more effectively, and strengthens overall cardiovascular health. These are changes you cannot negotiate with if you want to maintain male strength in a sustainable, long-lasting way. We've come a long way from understanding biological leakage to adjusting mindset and lifestyle. Now, the most important thing is not to stop at knowledge, but to follow a structured action plan. As a doctor, I want to give you a clear roadmap so you no longer feel lost on the path to reclaiming your confidence. Start tonight with immediate changes. First, remove performance pressure from your mind by practicing cognitive reframing and opening up to your partner to release tension. Remember, connection and pleasure are the goal, not a test of ability. At the same time, avoid alcohol completely before intimacy and use strategic, low-effort positions to preserve blood flow for where it is needed most. Tomorrow, your physical training begins. Do 3 sets of Kegels every day to strengthen the pelvic floor, and spend at least 30 minutes on aerobic activity such as brisk walking. If you smoke, start a quit plan immediately because nicotine is a direct enemy of your blood vessels. This week, pick up the phone and call your doctor to review the medications you are taking and to do the necessary blood tests for blood sugar, cholesterol, and testosterone. Many patients ask me how long it takes to see results. Based on research and clinical experience, most men notice clear improvements within 2 to 4 weeks of disciplined practice. And after about 8 to 12 weeks, erectile function often stabilizes significantly. I once followed a patient who stuck to this roadmap fully. At his 3-month follow-up, he shared happily, that for 6 straight weeks, he had not experienced a single episode of losing an erection, and he felt more confident than at any point in the past decade. Finally, I want you to remember this. Erectile difficulties affect a very large percentage of men. So you are not alone, and you are not defective. This is a problem that can be improved with science and persistence, and in most cases, without medication or surgery. Don't accept living with silent shame. Start this roadmap today to regain confidence and lasting happiness as a couple. Your strength is in your hands, and I truly believe you can do this.